Hello, Emma. Can you explain the coronary arteries to me?
Sure. Let's start with the right coronary artery. It originates from the right aortic sinus. Its pathway is relatively simple compared to the left coronary artery. The right coronary artery is thinner, and it descends around the right ventricle in the coronary sinus, moving dorsally and downward. At the crux of the heart, it branches into the posterior interventricular artery, which runs in the posterior interventricular sulcus.
What does the right coronary artery supply?
The right coronary artery supplies the right atrium, part of the left atrium near the septum, the wall of the right ventricle, all papillary muscles of both ventricles, and the interventricular septum. It has several branches. Rami coni arteriosi. These supply the pulmonary conus and the anterior walls of the right ventricle. Ramus ventricularis dexter, RVD. This is a branch for the right ventricle. Ramus marginalis dexter, RMD, found along the inferior margin. Rami atrials dexteri. These supply the right atrium, including the main right atrial artery, which gives off the branch for the sinoatrial node. The artery continues as the posterior interventricular artery, RIVP, which supplies part of the left ventricle, especially the septal and apical regions. It also branches into the ramus posterolateralis's dexter, RPLD, supplying the lower part of the left ventricle and gives off the ramus nodi atrioventricularis.
What about the left coronary artery?
The left coronary artery originates from the left aortic sinus. It supplies the wall of the left atrium, the left ventricle, part of the right atrium, the papillary muscles of both atria, and the interatrial and interventricular septum. Shortly after its origin, it divides into two main branches. Ramus interventricularis anterior, RI or LAD. This runs in the anterior interventricular sulcus towards the apex of the heart. It has diagonal branches, Rami diagonals, that supply the anterior wall of the left ventricle, and septal branches, ramus septalis, that go into the septum. Ramus circumflexus, RCX. This bends around the left side and runs in the coronary sinus in front of the left ventricle. It has marginal branches, Rami marginalis, such as the ramus marginalis sinister, RMS1, RMS3, which often supply the lateral wall of the left ventricle, and the terminal branch ramus posterolateralis's sinister, supplying the lower wall of the left ventricle.
Can you explain the dominance of coronary arteries?
Sure. Coronary artery dominance refers to which coronary artery supplies the posterior descending artery, PDA, and the posterolateral branches. There are three types. Right dominance. The PDA and the majority of the posterolateral branches are supplied by the right coronary artery. This is the most common type. Balance dominance. The PDA is supplied by the right coronary artery, and the posterolateral branches are equally divided between the right and left coronary arteries. Left dominance. The PDA and the majority of the posterolateral branches are supplied by the left coronary artery.
What happens if there is stenosis in the coronary arteries?
Stenosis, or narrowing, of a coronary artery can severely impact blood flow to the heart muscle. For instance, stenosis in the artery supplying the AV node can lead to rhythm disturbances due to inadequate blood supply. Additionally, if the His bundle is affected, it can cause conduction system issues. When stenosis occurs, the perfusion of the right ventricle and the lower part of the left ventricle can be compromised.
How do we visualize the coronary arteries?
There are a couple of main methods. Catheterization coronary angiography. This involves a standardized projection to visualize the coronary arteries. CT angiography. This provides a 3D visualization of the coronary arteries, giving a detailed view of the coronary anatomy.
What about the nutritional areas of the heart?
The American Heart Association, AHA, describes the myocardium of the left ventricle in a segmental arrangement, dividing it into territories or segments. The left ventricle is divided into three sections, with the apex being the 17th segment. By assessing these territories through echocardiography, CT, MRI, or myocardial perfusion imaging, we can quantify the extent of any damage or disease. These territories also help in evaluating the morphology of the affected coronary arteries. For example, the lower and bottom part of the septum is supplied by the right coronary artery. The upper part of the septum and the anterior wall is supplied by the ramus interventricularis anterior. The lateral part is supplied by the ramus circumflexus. This structured approach allows for precise assessment and treatment planning based on the specific regions affected.